Hi everyone, I want to welcome you to Dementia 2. If you haven't watched or listened to my first presentation on dementia, which is Dementia 1, I will advise that you do that before listening to this Dementia 2 because it's going to be a kind of series and you'll be able to understand Dementia 2 better when you have listened to Dementia 1. Okay, let's go. Risk factors. When it comes to dementia, there are many risk factors to be considered. And the first one that I would like to talk about is increasing age. The older we become, the more the likelihood of coming down with dementia if there are other risk factors in us. That is why dementia is very common among the elderly. But there are certain types of dementia that could present itself even at a younger age. We'll go over them later on. But Alzheimer's disease, for example, is commoner among the elderly. But the second risk factor is genetics. In genetics, like in other parts of life where we inherit a lot of things from our parents or grandparents, we sometimes inherit some trouble, like dementia and Alzheimer's disease, Huntington Chorea, Parkinson, or familial frontotemporal dementia. It's possible we have chromosomal anomalies like we have in Down syndrome. Anyone diagnosed with Down syndrome with the clinical features stand the risk of coming down with dementia later in life. When it comes to vascular dementia or multi-infarct dementia, hypertension will be a big risk factor. Another risk factor is diabetes mellitus. Still on risk factors for dementia, depression is a risk factor. And depression could even be a differential diagnosis. Someone diagnosed with depression and is getting older may come down with dementia later in life. Smoking. I will make a separate presentation on smoking cessation, but when it comes to vascular dementia or multi-infarct dementia, smoking is a big risk factor. So kindly work your way out to stop smoking. Impairment of the senses, for example, hearing impairment, is a big risk factor when it comes to dementia. Infections are not left out, like sexually transmitted diseases, particularly HIV, with the possibility of HIV dementia complex. It's a risk factor. Air pollution has been pointed out in some quarters, though there are no facts to back it up in many literature, but it's worth noting that traumatic brain injury is a possibility of coming down with dementia later in life. Alcohol, increased alcohol intake or high alcohol intake for a long period of time in your lifetime might enhance the possibility of coming down with dementia if you are predisposed with other factors. Increased estrogen, okay, stroke, and sedentary lifestyle with obesity. All these will be serious risk factors when it comes to multi-infarct dementia or vascular dementia. Still on risk factors: diabetes mellitus, hyperlipidemia, stroke, obstructive sleep apnea. In this case, a very severe obstructive sleep apnea, atrial fibrillation, myocardial infarction, increased coronary artery calcium, and atherosclerosis will all serve as risk factors when it comes to dementia. You know, if you have listened to my first presentation, it's not only Alzheimer's disease that is the cause of dementia, but because majority of people are familiar with Alzheimer's disease, you might think, what is it talking about? Will all this lead to Alzheimer's disease? No, because we have different types of dementia. I think we have about 13 of them, which I will go over in the course of presentation or series of presentations on dementia. Then all these risk factors are about all of them, not Alzheimer's disease alone. Prevention. How can we prevent dementia? Well, physical exercise, that would decrease the chances of vascular or multi-infarct dementia. Okay, when we treat hypertension or treat diabetes mellitus, control our diet and have healthy diet with omega-3 fatty acids or fish oil, we might be able to control vascular or multi-infarct dementia. Some attributed dementia to low level of education. So getting increased level of education might be an advantage. And maybe I should crack a joke here. For listening to this presentation may be part of the education that some people have advocated for. Weight reduction. Antioxidants like vitamin E and vitamin C, but there's no proven proofs or any facts that it truly prevents dementia. However, it improves function in affected individuals. Statins. Some believe that statins could help. Others believe that it will actually worsen it. But I personally believe that if you have high cholesterol and you're on statins, or you have diabetes mellitus and you're on statins, it's likely that your prognosis will be better as far as multi-infarct or vascular dementia is concerned. Some think that happiness and having good relationship will help when it comes to dementia. So be happy or relate well with others. Well, the truth is that nothing cures dementia. The cure is not yet identified. For now, the conclusion is when you know the risk factors in you, work in the opposite direction to it. In other words, prevent what is preventable. We can do nothing about genetics or chromosomal anomalies, which is accountable for many of the dementia types that we have. But we can prevent what we can prevent, like vascular and multi-infarct dementia with probable causes that are modifiable. There'll be more on dementia, and the next will be dementia with Lewy bodies. Kindly subscribe so that you can get these publications immediately they are released. Thank you.